Hey everyone, welcome to the Bio Breakthroughs podcast. I'm your host, Jared Taylor. Joining me today is Frank Watanabe, the president and CEO at Arcutis. Frank, how's it going?
I'm good, Jared. How are you?
I'm doing well. Excited to have you here. Uh,
My pleasure.
let's dig right in. I always like to start with a question
Sure.
for the people that maybe have not heard of Arcutis. What is kind of your breakdown of what the company does that you would tell them?
Yeah, sure. We are an inflammation company focused primarily in the medical dermatology space. We've got three products that are FDA approved currently on the market. We have a fourth one in front of the FDA right now. And then we have a pipeline of other assets that we're developing as well.
And what has this year kind of brought for you? Like I've had a lot of companies on here, and I've heard kind of a mix of what's happening in the market from all different guests, right? But for your particular situation, what's going on? Like, what are you excited about? What are you kind of keeping your eye on
Yeah.
towards the future?
Yeah. Yeah. It's actually been a very eventful year for us. We received our first approval back in the middle of 2022, but we received two product approvals this year for two of our new products. And we've launched both of them this year as well. So it's been a very busy year for us. One was launched in January. We got the approval actually back in December, launched in January, and then we launched a third product in July. And in July, we also brought on a partner to work with us in the primary care space. So it's been a very busy but really constructive year. The product is growing. The products are growing very nicely. And we're in the business of helping people, and the more people we can help, the better job we're doing.
Now, you mentioned partnership. Like, how important are partnerships like that in helping you continue to execute on your mission and vision and to continue progressing?
Yeah, it's a great question. It really, I think, depends on the markets you're playing in, right? So our products are dermatologic products. We have our own specialty sales force that calls on dermatologists, and that's a reasonable thing to do for a smaller company like Arcutis. But about half the patients are treated outside of the specialist setting, mostly primary care physicians and pediatricians. And there are literally hundreds of thousands of those doctors in the United States, and it takes a large sales team. It's hard for smaller companies to play in the primary care space. And so we chose to access primary care through a partnership. We didn't want to ignore those patients, obviously, but we didn't really feel like we could do that ourselves. And so we've partnered with someone else to do that. And I think that that's not uncommon when you see in larger markets, the smaller companies will look for a bigger partner to work with.
I mean, it makes total sense. It's especially, unlike a lot of things, right? Like, you're not going to go and try to do your own thing in the primary care space. It wouldn't be a good use of your time either, right?
Or money. Yeah.
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 Now, you mentioned something in what you just said. You mentioned the patient, and I know Arcutis is known for its patient-centric approach, right? So,
Yep.
how do you personally stay connected with the patient community to, ensure that their voices are heard in the boardroom decisions?
Yeah. Yeah. There are several different ways that we go about doing that. I think first and foremost, we actually have 8 dermatology clinicians that work at the company, 3 board certified dermatologists, a dermatology nurse practitioner, and 4 dermatology physician's assistants. And a number of those people still practice dermatology as well. So they see patients, 1 day a week. And that keeps us as an organization very relevant and current with what dermatologists and their patients are struggling with. And so every decision we make, there are people at the table who've spent their lives treating the patients that we're trying to help. And that's very important. The second thing is we routinely bring patients in to talk to the staff, or we bring dermatologists in to talk to the staff. We had a meeting last month, and we brought a dermatologist in to talk about their experience. At our most recent launch meeting, we actually had 2 patients come and talk to the team. And so that's a second thing that we do to keep in touch with what they do. And the third thing is I'm out in the field quite a bit. I am out in the field with our reps, at least once a month, talking with doctors. Sometimes I get to actually meet patients when I'm out on those visits if the doctor introduces me to someone. And that really, again, helps us to stay very connected with what are the real struggles that patients are dealing with. Our mantra at Arcutis is meaningful innovation. And I often get asked the question, well, what does that mean? Well, meaningful innovation is innovation that people need, right? And the example I use is I'm a Tesla owner. I love my Tesla. Nobody needs a car that goes 0 to 60 in 3 seconds. I'm sorry, you just don't need it, right? So that's a useless innovation. It's an innovation, but it's not very meaningful, right? Whereas never having to go to the gas station, okay, that's a meaningful innovation, right? I love the fact that I never have to go to the gas station anymore. And so by understanding the struggles of dermatology clinicians and the patients that they're treating, that really allows us to focus on things that will make a difference for them.
It's interesting though, even though it's, as you said, it's not necessarily a meaningful innovation, everyone like knows that. So
Right.
worst case, it was a good marketing.
Absolutely.
Yeah.
It's just like the almost a flamethrower, not a flamethrower, which was a flamethrower, right?
Absolutely. Yeah. It's, well, I learned something new, like, cause I've been a big fan of Tesla but what we noticed down and, we just went through the hurricane down here in Florida. You can't have salt water on those batteries. So people, left their house because they had to.
Yep.
So, but here's what'll happen. Tesla's not one of those companies, and all these other EV companies. They'll come up with something for like flooding like that's the only way you can continue to innovate, right? You see there's a problem, then you
Right.
fix it.
That's
But
right.
that's like a problem for like just pretty much Florida. You're not going to have 4-foot flooding, in Boston or these other areas, more than likely, right?
That's right. And salt water as well,
Salt
right?
water. Yeah.
That's the key. Yeah, I saw that video of that Tesla in the garage. That was scary.
Yeah, it was crazy. I mean, luckily, I don't think anyone was home, right, because of the evacuation. But
Yep.
yeah. So, Frank, given I want to shift focus a little bit to. I don't want to beat this. I feel like everyone hits this drum now. It's everyone mentions AI on a podcast or what they're doing in their business, but it's still important to talk about. So we're going to keep talking about it. Given the rapid advances in AI and machine learning, how do you see these technologies influencing drug discovery and development as it relates to dermatology? And then how is Arcutis preparing for this shift?
Sure. So this is probably not going to be the answer that you're expecting, but we actually have not incorporated AI very much in our business. I think that as I look at the broader pharmaceutical space, I think that artificial intelligence is probably going to play a meaningful role in drug discovery, right? The process that we usually go about, especially in the small molecule world, is we find a target, then we try and find a chemical that binds with that target in a way that has some physiological benefit that we're looking for. And then we go through a process called SAR, where we're constantly mutating that chemical to see if we can make it perform better. That's a lengthy process. It's a very costly process. And I think both of those pieces, one, figuring out drugs to dock into targets, and then iterating on those targets, are things where AI is really well suited to work. Arcutis doesn't do drug discovery. We do drug development, right? Once someone else has discovered a chemical, then we will develop it. So we don't leverage that. I do think that with the biologics as well, the ability of AI to understand how proteins fold and unfold can be an important part of drug discovery, and I think AI will play an important part there too. So I think on the front end of drug discovery, I think we're going to see some really meaningful impacts of artificial intelligence and especially machine learning. In the area that we work, which is drug development and commercialization, we haven't really seen a strong business case for AI yet. I think we'll continue to monitor the situation, but we aren't a company running around talking about how we're incorporating AI into our business, to be honest.
Okay, here, not to get you in trouble here, but do you think there's like, I feel like a lot of companies, regardless if there is the use case, they try to. So I appreciate you
Yeah.
not just putting it out there, right?
Yep.
And that was the most honest answer I think I've heard on this show regarding anything AI related. Because you didn't say you weren't a fan. You just said you haven't found the right use case for
Right.
your particular area, right?
Yep.
And that could change.
Yeah, absolutely.
Um, Interesting.
We have a dedicated digital team led by a really outstanding chief digital information officer, and they're constantly looking at this and studying it. But we don't want to just adopt AI because it's the flavor du jour or because, everyone else is doing it, right? When we find a way to use it, we will probably use it. We just haven't found that right use case yet.
Especially startups. That thing, AI gets slapped right on that deck, and then it at least you get the VC's attention when you go into the meeting with that, right? We'll see how it continues to go.
I think, um, look, first of all, I think AI is a revolutionary technology, right? And I don't think we still know how it's going to impact our lives in general. Um, but we also go through these periods. A couple of years ago, everyone wanted to talk about ESG, right? Environmental, social, and governance issues. I never get asked about ESG anymore. It doesn't mean it's not important. It's just not the flavor du jour at the moment. And if you're constantly chasing whatever's the flavor du jour, you end up chasing your tail half the time. Right?
What was like even people trying to come up with use cases that made no sense for blockchain a few years ago, right? Like,
Yep, that's
oh,
right. That was another one of the
our
buzzes.
database is
Buzzwords.
going to be, blockchain. It's like
Yeah.
well, it doesn't need to, like what? uh,
Exactly. Exactly.
yeah, it
I,
was.
I have an expression. It's not my expression. I love the expression when all you have is a hammer, everything looks like a nail. Right. I'd much rather go for a full up toolbox of different tools.
I will tell you, the blockchain and like crypto days though were a lot of fun because I was living in Boston at the time, and they had all these great events. Like it was awesome. You met some really great people. MIT put on some great blockchain events. Um, there was a lot of like similar to kind of. I think AI is still a different. AI has more impact on like pretty much every company, right, and consumers. But it was a fun time whenever you have those technologies because there's all this educational like
Yep.
courses that pop up and everything. So yeah, hopefully that continues to be the case though with AI, where we have these great meetups and we made some awesome people. Um, I want to shift focus a little bit. So under your leadership, Arcutis has achieved significant milestones, but not to do this in necessarily a bad way, but I always wonder, right, when you've had these wins, even with these milestones, what's like if you could go back and like maybe change something or think of something differently at a certain time, would there be a particular strategy or something you would want to take another look at? I don't want to get you ask the wrong question here, but I'm just curious.
It's an interesting question. I would say, uh, Arcutis has been remarkable, right? We started about 8 years ago. June was our 8th anniversary. And at the beginning, it was 3 guys and $150,000 in the bank and an idea. And little over 8 years out, we're 350 people. We have 3 FDA-approved products. A fourth one, soon to be on the way. We're helping thousands of patients. To have accomplished that in that short a period of time, I think is nothing short of remarkable from my perspective. I'm very proud of what we've achieved, and the team is amazing. There aren't any major decisions at Arcutis, specifically vis-a-vis Arcutis, that I would do differently. I'll be honest. If there was one thing that I could tell my 25-year-old self, it would be to spend more time with my kids. I dropped my youngest son off at college in August, and I'm now an empty nester. And I wish I'd spent more time with them when they were kids. I was too busy working. I spent too much time on the road. I had too many other things going on. And you wake up one day and they've grown up and they're gone. And that's something that I tell my younger employees. And I really encourage my employees to make sure that they are spending time with their families, even at the expense of working, because the work can always get done later. You don't get another chance with your kids.
So let's shift that question. Like, how do you find that balance then? Like, because this is I hear a lot of people come on here
Yep.
and they struggle with this, right?
Yep.
They're like,
Yep.
I struggle to find the balance, and they're not even saying it in a bad way, right? Like, because at the time, I'm sure even when you were doing certain things, like it was just part of the part of the motion, right? You didn't feel like there was maybe a balance issue or anything like that. So how do you find that right balance?
Yeah, I think it really depends for every person what is the right work personal balance, and you can't impose it from on high. One of the things that we do at Arcutis to help foster that is we provide an immense amount of flexibility to our teams in where they work and when they work. So I have staff that work in the morning and they don't work in the afternoon, and then they work in the evening. Some staff work 7 days a week. less time spread out across 7 days. Some want to pack it all in 4. As long as the work gets done, right, I rely on them to figure out what's the right work schedule for them. I think the challenge really for each one of us is you have this work in front of you, and this has only, I think, gotten worse as people have started working remotely, from home, because your work is already always right there, as opposed to leaving the office at 5 o'clock, right? And your kids, your family, your friends, you can always put that off, right? You can always make some excuse. Well, I have to get this done, and tomorrow I'll spend time with the kids, or this weekend I'll spend time with the kids. And you have to draw boundaries around the work so that it doesn't consume everything. And that's something that I've learned as I've aged. And I wish I could do it over. I think, the other thing that works for me personally is that I delegate quite a bit. I have a great team, and I don't believe in micromanaging, and I trust them to get stuff done. And that frees me up to spend more time with family and friends. And it also frees me up to think, right? Which ultimately is what you would hope your leader was doing, and not just be in the trenches all the time. But that empowerment and delegation of other people is good for me, and it's good for them.
I realized something recently, like the work will always be like, it'll never go away, right? It's also one of the issues when people want to go on vacation now. It's like the email, they think more about what's the work going to look like when I come back, and my
Yep.
emails and things like that. So it's interesting.
I had an interesting experience. I was living in Europe a number of years ago, working for another company, and I took a 2-week vacation. And about a weekend, I started getting antsy and started calling the office. And is everything fine? No, yeah, it's fine. Every couple of days I call them again. Is everything okay? Yeah, we're fine. Yeah, yeah. They were perfectly fine without me. I wasn't okay without them. Right.
Yeah,
That
but
was
that
a
takes some
humbling
getting used to.
experience. Yeah,
Yeah,
absolutely.
because probably when you called at some point, you were hoping, get
Yeah,
back
you
here,
could
we
be the
need you,
hero.
right? And it's like,
Exactly. Yeah. But
yeah.
if you do your job right as a leader and you build a strong team, it's optimal. It's a compliment to you if your team doesn't need you. It means you built the right team, right?
Yeah, and that's not easy to do either. So that's interesting. I want to shift focus as we start to kind of wrap up here. We usually keep these around 20 minutes or so.
Yeah.
Um, do you see any parallels between let's because like given your background, like strategic military planning and the way you approach long-term planning and risk management in biotech?
Uh, there probably are some similarities. I think there are some important differences. Right. My background, I was a Navy officer, served for 24 years in the Navy. Um, the military exists to fight wars. That's our primary job, right? Which involves killing people and breaking things. That is fundamentally different from business, right? If you're killing people in the business world, you're doing something wrong. So I think the nature of warfare and the nature of business are very different. I think that there are an immense amount of parallels in terms of leadership. And yeah, I do think that there's probably some lessons that I learned, for example, in the whole strategic planning process from my military experience. Wargaming, I think, is an example of something that has translated very nicely from the military into the civilian world and in the business world. So there are bits and pieces. But I do get a little nervous when people, business leaders start, quoting from, The Art of War or Clausewitz or something like that, because they really are very different endeavors. And you look at the people that I know who were military officers and who now moved into the business world and are very successful, the characteristics that they brought with them that make them successful tend to revolve around those leadership characteristics, not the applying the way that you fight a war to the way that you operate a business.
My friend was Army Ranger, and he said something similar. He also talked about you could take away like the team building approach, like, and how close the bonds were, and how kind of what you were saying, right, where you went away, like you always were able to rely on a team member
Yeah.
to have your back, that type of stuff.
Yeah, I think
Yeah,
that's true. Yeah, yeah.
but you're right. It's more of the personality. It's the traits, not the necessarily the strategy, because it is different. Um, as we wrap up here, Frank, last question for you. In terms of what you can tell me here today, what's next for Arcutis that you're excited about, or that's in coming up?
Yeah, I think I would say three things. The first one is, as I mentioned, we just started this new partnership with another drug company. I'm very excited to see how that goes. It literally just started. We announced it in July, and they started promoting our products just a couple weeks ago, actually, 2 weeks ago yesterday. I think that has immense potential. It gives us great opportunity to help a lot more people. Um, the second is, I think I mentioned, we actually announced just a couple weeks ago, last week, that we have our fourth product that will be approved in May of next year. That's a really important new product, and we're very excited about that. And the third one is we are starting to branch out from commercial insurance into the Medicare and Medicaid marketplaces. And there are a lot of patients who have the diseases we treat on Medicare and Medicaid, about half of the patients. And I think it's critically important that we make this drug, our drugs, our products available to as many people as possible so that we can help as many people as possible. And just focusing on the commercial market, it excludes my mom. It probably excludes your mom. It excludes a lot of people who need access to medications. And I think that as drug companies, we have an obligation to try and make our drugs as widely available as possible so that everyone can benefit from it who needs it.
I love it. Frank, I want to thank you so much for coming on the show here today, and
Oh,
I
it's
look
a
forward to
pleasure
future.
talking with you. Yeah,
Yeah, I look forward to future chats. Thanks so much.
you bet. Thanks a lot.